You know what time it is? I said, do you know what time it is? It's time for KP's Video News. KP's Video News.
That's right. It's time for KP's Video News. I'm bringing it to you real and bringing it to you raw. That's right. If you want to watch fairy tales, time to turn me off and go watch Peppa Pig or something. Anyway, this story here I'm getting ready to talk about now is one that they're not really talking very much about in the news media, and it's all about the people that are incarcerated, that are having a real outbreak and a real epidemic of the coronavirus is spreading extremely fast, and inside these overcrowded conditions. And and I'm quite sure, as a theory, it's a real possibility that they could possibly be experimenting with this coronavirus vaccine on the people that are in prison. So I mean, this country has a history of that, using inmates for experiments. So I'm not, like I said, I'm not sugarcoating nothing today. The Bureau of Prisons coronavirus response under fire, reactive, not proactive, and that's what the inmates and the staff say. And in an internal message to the Bureau of Prison staff about coronavirus over the weekend, the Bureau of Prisons Director Michael Carvajal asked employees to have faith that they're doing the right thing, that they will protect inmates and staff, and that staff must not let fear of the virus distract them from their daily tasks. However, inmates and Bureau of Prison staff from facilities hit hard by the virus paint a very different picture. Prison employees spoke to ABC News about what they said was the BOP's lack of preparedness, which they believe jeopardizes the safety of officers on the ground and inmates in facilities. So when I say BOP, I'm talking about the Bureau of Prisons. There are over 200 inmates across the country who have tested positive, the BOP stated on its COVID-19 website. At least two officials described a lack of communication between the central office in Washington, D.C. and the boots on the ground, especially when it came to combating the spread of the virus at facilities. BOP rolled out the last stage of a 5-phase strategic plan on March 31st, which took the most restrictive measures, including keeping inmates in their assigned cells or quarters for 14 days and stopping all inmate transfers between facilities. In a statement, the Bureau of Prisons said it was taken and will continue to take aggressive steps to protect the safety and security of all staff and inmates, as well as visitors and members of the public. The Bureau pointed out the 5-phase plan, which in addition to the last phase included a task force to begin strategic planning and building on our already existing procedures for managing pandemics. Some of the other measures the Bureau said it took in that plan are suspending social and legal visits, limiting access to contractors and volunteers, and inventorying sanitation, cleaning, and medical supplies, and procuring additional supplies of these items. We put a little sidebar here. Just looking at that thing, said medical supplies and procuring additional supplies of these items. So when you're talking about a prison system that houses millions of people nationwide, and you have to look at each facility state by state, state by state, prison by prison, and you have to realize that the medical staff at these prisons, without a doubt, if this thing continues to grow the way it's growing, they're going to be completely and totally overwhelmed at some point. And so they're not going to be able to handle the caseload because the prisons are overcrowded. You can't, if you have one medical staff person to every 400 inmates. I'm talking about 1 to every 400. How could they possibly save their lives? It's impossible. Okay, back to the story. I think there's much more that they could have done prior to now. They could have followed the CDC guidelines. Congressman Fred Keller, a Pennsylvania Republican with 2 federal prisons in his district, stated. Keller has introduced the Pandemic Act, a bill that calls for putting a halt to all inmate transfers during the coronavirus outbreak. The CDC recommends social distancing, a practice of staying 6 feet apart and avoiding mass crowds or gatherings. Sidebar. The CDC recommends social distancing, a practice of staying 6 feet apart and avoiding mass crowds or gatherings. That's going to be totally, completely impossible to enforce when you're talking about inside a penitentiary or a county jail. Because, let's face it, you got people sleeping on bunk beds inside gymnasium type spots where they just ran out of room. You got, and things on that level. So there's no way in the world that you can space them out 6 feet apart when you're already out of room. It's just impossible. All right, back to the story. I think they've done things as business as usual and haven't followed the guidelines that have been set forth by the coronavirus task force to flatten the curve, and the results of them not doing that are evident because they now have more cases than 3 states combined, Keller said, and that to me shows that they need to be more proactive, not reactive. The BOP stated that it is constantly updating our nationwide guidance in accordance to the CDC's updates. Federal Correctional Institution of Elkton, Ohio houses 2,500 inmates. 3 inmates have died from the coronavirus and more are being placed on ventilators by the day. In early March, staff at the facility were already screened for the C virus, but according to the local union president, staff screening was shut down, not by the FCC's Elkton warden, but by someone above the warden, who Mayor Stress has been working together with him to be proactive. The local BOP officer union president explained that the worry is always the virus coming into the facility from outside through a staff member or a new inmate or visitor. Bell said though precautions were taken to keep the virus out of the facility, that there needed to be inmates showing symptoms of coronavirus to begin screening. They are always and always have been reactive instead of proactive. Mel said the BOP gave the facility 5 testing kits and then received 80 from Ohio, where the prison is located, according to a memo obtained dated March 31st to Columbiana County Health Department instructed officers to only go to and from the facility, wear a mask, and not allow visitors in their homes. The prison's medical team has been stretched so thin, according to the governor of Ohio, that the Ohio National Guard has been called into the facility to assist with medical care. One inmate housed at Danbury in Connecticut, who says he was sick with the virus and spoke out of anonymity of fear of retribution and retaliation, said she had to beg for an ambulance, and when she was at the hospital, she was monitored by officers 24 hours a day. According to the inmate, an inadequate thermometer misread her temperature as normal, but she claimed she had a fever. She also said that she was treated like an animal with no access to clean clothes. There are 28 inmates and 12 staff who tested positive for the virus at the female facility. A pregnant correctional officer at FCI Jessup outside of Atlanta returned from an overseas trip and was told she needed to quarantine. However, about 7 days later, she was called back into work, unable to refuse to or forced to use her own personal time time to take off. Jessup Union president stated that officers in the facility do not have access to hand sanitizer and were just given the N95 protection mask this week. An institution is not concerned with our staff being exposed to the C virus when staff have reported exposure. The agency's doctor has directed that so long as staff are not symptomatic, they immediately return to work or use their own leave. All it would take is one diagnosis, and we would be the new New York with the major infestation. So this is a crazy story here, folks. And you know, it's like this is actually going on right now. This is actually going on right now. So you know, it's you know, so Mail expressed what his staff and facility are feeling at the moment, are anxious and scared to take the virus home to their loved ones. He said right now it's a lot of anxiety and a lot of anger among staff, and so of course they should be angry and they should be upset because they're in the process. It could possibly infect their families and stuff at home, and nobody's taking them serious. They're not giving them what they need. And also, you know, that statement I just made was about the people that work at the facility are not being given what they need. And so without a doubt, if they're not being given what they need, that means definitely that the inmates are not given what they need to try to survive and try to get whatever they need to get to deal with this whole coronavirus outbreak. And they're going to die by the thousands, 10,000, 100,000, locked up inside of those cramped up facilities. So I'm gonna touch back on this story.
KP's Video News.
Peace.